Welcome to Passionate World Talk Radio. Educate, enlighten, entertain.
This episode of the Energy Stoners Cafe is sponsored by Passionate World Talk Radio and Lillian Caldwell. PassionateWorldTalkRadio.com. Welcome to the Energy Stoners Cafe. My name is Toni Quest, and I'm really happy that you're here. I like to interview the most interesting people I can find on the planet. So grab a cup of coffee, sit down, relax, and listen. You're going to find that these guests are so intriguing, you'll wonder why you didn't know about them before. Hi, everybody. Thanks for coming back to the Energy Stoners Cafe. I hope everybody out there is doing well. I hope you're safe and healthy, and I'm really happy that you came to join me on this show. I am so pleased to have, once again, Dr. Robert Clark on the show with us, and he's in the front lines, really. He's a physician in Augusta, Georgia, in the Augusta, Georgia area, and he's dealing with COVID as a physician, straight on, full frontal. And I'm so anxious to talk to him, and I'm so glad that he's doing well. Bob, how are you doing?
Oh, I'm doing fine. You know, the pandemic has also, stressed everyone like everyone else is, but we're hanging in there and doing what we normally do in primary care and taking care of people as best we can. Hopefully I know we'll get through it just fine. So yeah, but we're doing well.
Okay, that's a nice words of reassurance. What is the name of your practice again?
The Center for Primary Care.
Center for Primary Care. And Dr. Clark, I'll just share with the audience that Dr. Clark has been dealing with this pandemic at least as long as we've been dealing with this pandemic. And we're going to talk to him again because he gave such great information at the beginning. And now it's time for a follow-up because things have changed. Dr. Clark, what should we know about the changes? What changes with regard to the pandemic and the virus should we know about?
Well, I mean, the main changes is that us as clinicians, we have learned a lot more over the time period. Over the time when we initially started, if you remember, there was a lot of talk about ventilators, right? We need XYZ ventilators. We need, the hospitals are going to need all these things. And what we have found is that we don't need to be putting patients, we try not to put patients on ventilators unless the absolute necessary, because we know that patients who go on ventilators too early do progressively worse. We know now that we have great medicines to help treat or at least decrease your symptoms, which is mainly a steroid, which is very cheap. We also have other medications, antivirals. We have other newer antibody test treatments that are coming on board. But I would say, in my opinion, the game changer truly has been the steroids, not putting patients on the ventilator, patient positioning. That has been a huge factor. I don't know if they talk about that in the news media as much as that when patients are sick, that we put them on their side or on their stomach, not on their back. And that has made a huge difference as far as patient outcomes are concerned. And so those factors are really important. Putting patients on oxygen early and having patients go home on oxygen, that has also helped on decreasing mortality. However, the other change that has happened is that, the virus has gotten more aggressive.
Yeah, that's the scary part.
Well, it is scary, but, it's not what's fully expected. When we talked about earlier, the viruses do change and they mutate. And so they do kind of adapt. And so this one's going to be with us forever. Doesn't necessarily mean it's going to be as detrimental to society as it is now, but you just have to recognize that this is going to be here for a while. And we'll get a vaccine and we'll have layers of protection, but it's not the end of the world. As I said that before, and I'll say it again. It's not the end.
Okay, but I do have concerns about frontline workers and their exposure to it, and also the propaganda that goes around that really sort of disputes what real facts are. But let me ask you a quick question about why is it better for a patient to be ventilated or intubated on their stomach as opposed to their back?
Well, when you, I'm assuming you've never dissected a patient before.
I have
or
not.
Like in the
No.
medical, okay. So,
no, I have not done that.
You have not done that. So when you look at the anatomy of a patient, their lungs are in their back. They're not in your front. So when you're sick and you have congestion and you're laying on your back, you're actually compressing your lungs. And so when you lay them on their side or on their stomach, you allow those lungs to expand more. And so when your rib cage is open and your lungs expand, they use your sternum to expand out. And so like a little spring, they expand out from your sternum. So laying on your stomach or on your chest and letting your lungs on your back expand. That's why it works better.
All right. See, who knew? And I've also read some things, and maybe you can verify it or dispute it, that when people are intubated, there's a higher chance that they'll actually die.
Well, it's not that the intubation itself increases your mortality. The fact is that we are reserving that mode of treatment for the sickest of the sick. So when you're that sick and you have totally had complete muscle fatigue, and that's why we're doing it, then you're really sick and your immune system is not well. And so your mortality is higher because that indicates that it's higher, because you are that sick that you've worn out. It's not the intubation itself, the fact is that you're that sick.
Right, because the virus is there and it just continues to attack the body, it sounds like.
Well, and your innate immune system can't handle it any further. We have things to help, but your own immune system is not able to help out as much.
So what's going on, like, from where you sit, is with regard to testing? Like, what do people like me need to know about testing for COVID? I got a COVID rapid test. It was a piece of cake, and it was so easy. It was the rapid test that I wondered, what's the big deal?
So it depends on where you got it, but the rapid test is great. I've tried, and I'm glad we finally have gotten the rapid testing. And it's available now. You can get your results in 15, 20 minutes, finally. And it's also at places where people can go to their doctor or their clinic that they go to and get those tests if they wish to. And so that has been helpful in letting people know who are sick. But I think it came too late, in my opinion. I wish we would have had it earlier. I think we would not be here if we would have had it earlier. And that isn't just me. That's many people who have said that. But it's good, and it's not that terrible. People have initially said, "Oh, you're going to throw the Q-tip up your nose to your brain." Well, the answer is no. Okay, I've heard all those. No, but we got to get a good sample, and it's not too bad.
Yeah, I've heard that there's one test where it goes in very, very deeply. Some people can't take it, like people. I know there's someone personally that can't do that particular test because of their tendency to get nosebleeds. So the rapid test was the only one that she could take.
There's a rapid test that goes all the way back too. So and there's one that just kind of goes on the outside of the nose. Yeah.
On the outside, on the inside, on the outside, right?
That's right. Inside, outside. Your outside and my outside is a little different, but yeah, just on the very middle inside of the nose.
Yeah, I heard that the regular test is just uncomfortable. It's not like a horrible thing. Anybody I know that's had it has said it's uncomfortable, but it's not unbearable.
That's correct. It's not like an NG tube, which is a nasal gastric tube where we have to shove it all the way down into your stomach. No, it's not that.
That's great.
It's not that.
Ooh.
Yeah,
anyway,
no.
I can very visual person. Anyway, I'm just saying I can imagine. All right, so that's good. And I think a lot of people have questions about that, and I'm glad you've answered it. And then do you see an increase in the virus in your practice? Do you see that there is an increase the way we see when we look at the numbers on TV?
First of all, that's a good question. I would encourage people not to look at the numbers on TV because they're not accurate. And the reason why they're not accurate is because of what your previous question was, is that the rapid tests. Mm-hmm. So all those rapid tests aren't necessarily being reported.
Oh,
Okay, because they're androgen tests. And you have to remember that in medicine, we generally under-report numbers, not over-report numbers. No one likes to do paperwork. You don't like to do paperwork. I don't like to do paperwork. No one likes to do paperwork. So you just have to recognize that in medicine, we always know that the numbers are always going to be underreported. So it's not important what the numbers are. What's important is the trends. It's all about trends. And so right now, we're in a trend, what we call accelerated growth trend. That's different than linear growth trend. And so accelerated growth is, if you think of it like a rocket ship, you see that rocket steam is going right before it takes off. Well, that's where we're at right now, where there's a lot of smoke, and we know that rocket ship is going to go up.
it's going to take off.
It is going to take off. So the only thing we're doing is not trying to prevent it from taking off at this point. What we're trying to do is have its trajectory not go that high.
So it's like mitigation.
That's right. So that's why you have the CDC saying, hey, look, don't have these massive gatherings at Thanksgiving, because that's going to make that trajectory higher. It's going to go for the next 8 to 10 weeks. We're going to have a bad time in the next 8-10 weeks.
But the bad time is really going to be for frontline workers like yourself.
It's going to be for everybody.
Yeah, well, I guess so. You lose people. It's just so scary. I have to say, it's just like...
Well, and I say this to my patients all the time, too. The news media's job, and I'm not bashing the news media, is to show you the abnormal. It's there to give you the worst stuff, and because that makes people really want to watch. And the abnormal of COVID, or SARS-CoV-2, is what I like to say, it is the mortality. That's the abnormal, because the mortality rate is really running around 2.5%. I mean, that's not to diminish the tragedy of it at all. It's very tragic. However, the vast majority of people, recover.
Right. That's a good thing to know.
Yeah, a vast majority. Unfortunately, the real issue, and people need to understand, is I think the greater problem is the fatigue and the shortness of breath that lingers for weeks, is what we call chronic malingerer syndrome. That is the one that's really has people having a tough time for several weeks after they had it. And that's a significant percentage. That's higher than the mortality rate. That's probably running about 15-20%. And so that's a problem.
They have to learn to live with the virus, it sounds like.
No, the virus is gone. They just got these symptoms. Yeah, they're just tired. They're just short of breath for weeks and weeks. And everyone's doing all the testing and trying to figure out what it is, and they can't see anything wrong with them, but they're immensely tired and short of breath. And it lasts for several weeks.
How did the president recover so fast? What was that? Why did he recover so quickly?
Oh, yeah, I have patients who've asked me that. So you can't go by the president, okay? The president receives different kind of health care than anybody else. Any president does. But so you have to remember that the White House has an ICU in it.
Oh, I didn't know that. I don't think anybody knows that.
Okay, so they have an ICU that has a nurse and a doctor in the basement. So you have to know is that for the president of the United States to have to go to the hospital, he was pretty sick already. Okay. And so, which illustrates my great point. He received 3 medications, and one of them was an experimental antibody. The other one was the antiviral, and the other one was a steroid. But the most important one was the steroid. That's why he was acting so revved up, because the steroids really have been a game changer. As I said earlier, they really have been a game changer for patients. And so if you have a patient who's requiring oxygen and you give them steroids, they can do well. And that's what happened with the president. I don't care what his press secretary says or anybody else says. He got on oxygen. They immediately did what they were supposed to do. They gave him steroids. He got the antiviral because he's the president. We normally don't give that to patients. And he got an experimental antibody, which we normally don't give the patients that early. But the reason why he recovered is because he got his own steroids. Some massive amounts of steroids, yeah.
So it gives you, so I don't know that much about it. What I know about steroids is that they reduce inflammation.
That's right.
And they create this artificial bravado.
Well, that's one of the side effects, yeah. So you get a little revved up. Some people get a little manic. that happens. Prior to this interview, you were talking about the South. I had a patient. She was a petite, nice Southern lady who had a rash, and I put her on steroids one time, and her husband came in a couple of days later and said, "You got to take her off because she just threw out all the clothes out in the front lawn and ripped up all my stuff, and she went crazy." Yeah, so it can happen, you know. So it's one of those side effects.
Yeah, I guess you kind of lose your mind a little bit, I imagine. It's interesting you said that people have these lingering symptoms because, naturally, if you're living, unless you're living under a rock, you probably know somebody that has come down with COVID, and I know a friend of mine had it. She was sick for 8 weeks. I'll tell the audience that this is no joke. She didn't die, but she was very, very sick for 8 weeks. And there's a point where you kind of thought you were going to lose her. But then she recovered. And this is a woman that was in very good shape. She walked about 4 miles a day, and she was just fit. And you wouldn't think that it would take her down like that. But now she talks about being tired.
That's right. That's a more common side effect from having this virus, that you end up being very, very fatigued. And that's much more common than mortality. It's a real problem. Real problem.
Do you find as a doctor, that fatigue is one of those things that patients kind of play it down?
Well, yeah, I think, our society is one of, hey, you feel a little sick, get up, go to work, right? Hey, I push through, I feel like I'm a little stressed, but I just keep on going. Yeah, and that's generally how our culture generally works. And so people do generally downplay their fatigue. Are
you finding that you're getting patients that come in? Because I know a lot of, and this is really sort of outside of the virus itself. I found that people that I know are talking about this depression. They're just so depressed or like hyper anxiety, like this anxiety, and that seems to be the symptom that regular people are having. That's a response to just the whole climate of things. So you've patients calling on you and they go to see you. They think there's something wrong and you find out that they're depressed.
That's all the time. And that, as you remember, when we started this pandemic, that was the great call in April, that a lot of the physicians were saying, look, we're going to have a serious mental health crisis in the country because of this pandemic, and which is again showing its head. These things take time, but absolutely, all the changes. You have multiple different personalities in the country, and you have some people who need interaction to feel themselves being centered, and they need interactions with people. And so when they're denied that, it causes them problems. You have people who control their anxiety by working in the gyms, right? They know that my exercise is when I'm exercising 3-4 times a week in the gym. That calms me, that centers me. And then you close all them, they're having a real tough time. You just have those things that are occurring throughout the country.
Yeah, I'm thinking about a conversation I had with someone recently. I mean, I don't know how often this happens, but I've read that there's problems with people being locked down. It's one thing to be alone and you cross that threshold from solitude into loneliness and you get depressed. But then it's another thing I imagine, to be with somebody that you're not used to like living with, and then all of a sudden all the ugly comes out. And then it turns into something else.
Well, yeah, that's absolutely. People under stress have much more problems, and also decrease in immune systems and things like that. So, yeah, no, depression, anxiety is a major factor of what's going on and how people are feeling. And I see it every day. It's been like that for a very long time, and that's part of primary care, that people come in. We're frontline people. They have multiple symptoms, and we find out, it's really your anxiety that's causing your chest pain, or it's really your depression that's causing your stomach problems.
So how do you treat it?
Well, first we have to have a relationship with a patient that when that comes up, that you can talk to them and say, okay, look, I really think you need to either talk to someone or start some medication, because that's where your problem is, not that you're having a heart attack.
And that's good that they're not having a heart attack. That's worse than depression.
Well, I don't know. I mean, you have to remember that one of the major killers in the United States is suicide, right? And so suicide has been increasing during this pandemic also. That's a real deal too. We downplay mental health a lot, but the fact is that suicide kills more people than gun violence. I mean, suicide's a real deal. Kills on average in the United States about 45,000 people a year.
Wow, that's a lot.
Well, gun violence is only 23.
That's a reason to pause and think about that for a minute.
So we don't give it enough credit, the mental health. And unfortunately, it's not funded very well. It's not a popular topic to talk about, but it's the real deal. And it's nothing to joke about.
Yeah, I'm not going to joke about it, And it's the reason I'm saying this because I've been talked to this person, and I'm not a doctor. I'm just a person that's dealing with my life, and I couldn't understand why she was so upset that someone that was abusing her was leaving her. I said to her, I joked, I said, I don't want to get some calls from Lester Holt, from Dateline NBC. All your friends are going to be sitting here crying that something happened to you because this guy. And they're going to ask us, didn't you know? Why didn't you help her? It's like, I told her, just get a grip and get rid of him, But now that I'm talking to you, I think that she should still get rid of him, but maybe she needs some medication.
Yeah. And that might be, or, definitely talk to people or help with counseling and those kind of things. Yeah, absolutely.
As a society of like a community of people, like how do we help each other? Can we help each other and not be the professional? Because I have friends that are having a lot of problems with this. I mean, I'm having some problems with it, but not that bad.
Keeping in contact with people, knowing that you're there is probably your best thing, whether you do it on Zoom, whether you stop by and, talk to them briefly. That is the way you can show support. You just need to be in contact and know that someone's there. I think that's the first step in a long road to try to help someone out. And listen to them, and not always think that you have to give an answer. I think we like to give an answer. We think that there must be an answer. Sometimes the answer is just listening.
Yeah. That's good advice, I think, also. And I think a lot of times, this is the other question I have to ask you this. Like, how concerned should we be about going out? I know that I've got, people and myself have turned to like not trying to avoid going to a store. You call up like the delivery service, Instacart, have your groceries delivered rather than go in the store where everybody's touching everything. The balance between doing that and being safe and being isolated is a very tough balance to keep.
You're right. And so that brings up a really good topic with regards to prevention. You have to think about preventing things as, have you ever seen a slice of Swiss cheese?
Yeah, I've seen it.
You ever heard of the Swiss cheese model?
No, I haven't. Tell me.
Okay, so Swiss cheese model is if you take up a slice of Swiss cheese and you put it up and you have a light behind it, and you can look through it, right? It has lots of holes in it. And so then you take up another slice and you put it behind that. The holes don't necessarily line up, but the other slice has holes too. And you have another slice, and then pretty soon the light, you put enough slices down, you won't see anything. You can't see that light anymore.
Okay.
And so that's called the Swiss cheese model. What you have to understand about protection is that none of these protections are 100%. And so they all are slices of Swiss cheese. And so you have to think about it like hand washing is a good thing, okay? But it's not 100%. It's a slice of Swiss cheese, has some big holes in it. So then you have your mask. Let's say you have a 3-layer mask. 3-layer mask gives you 83% protection. That's good, but it has a 17% hole, right? So it has some holes in it.
Right.
Let's say you have distancing. That has some holes in it. It's not 100%. Let's say you have a vaccine. That's 92% effective.
You got 8%.
That's right. As you see, you're dealing with layers. So when you're going out and you're talking about, okay, where am I going to go? Obviously a face mask is important. I can talk about why that is, but later. But that's really important. Hand washing is next important. Wiping down, that's not as important as washing your hands. It's an important layer, but washing your hands is much more important. It gives you a lot more protection. Social distancing is important. Location of where you're going is important. Let's say you're going to a restaurant, you would want to eat outside. You don't ever want to eat inside because of something called aerosolization. That's what you really have to judge on. And so as we enter the holidays, some people are going to go visit. You just have to recognize that people are going to go visit. But you need to visit in an appropriate way, not have very many people, wear your face mask. If you're going to eat, you got to move away. You're not going to all eat at the same table. You're going to move at the other ends of the apartment. Then everyone put back on their face masks and you go enjoy yourself. Okay, so wash your hands, but not have very many people. You just have to think about your protection as layers of protection, and nothing is 100%. And so you're trying to layer up, and that's how you have to think about your protection.
Are we going to be able to get together? I mean, I know I'm not getting together at Thanksgiving, but some families are really just desperate to do it.
We have to recognize that that's going to happen. CDC recommends not to, but people are, just like you said, depression. They need to see their family members. And so if you have to, again, I would recommend not to do a large gathering at all. Very small gathering, less people the better. And even with the less people, if you even have 4 or 5 people together, you would wear a face mask throughout the whole time. And then everyone wash their hands. It's time to eat, say your prayers, then grab your plate, and then you move away to a separate area to eat. And then after you finish eating, you immediately put back on your face mask. What you've done is you layered up. You've cut down on the amount of infection going around because at this point in the country, you have to assume that everyone is infected. You have to assume everyone's infected. You can't assume not this person is not infected.
Right, and that hasn't changed from the beginning. We had to assume that everyone was affected. It's just there were a lot of people rebelling. It almost seems like we have a vaccine before the vaccine. The vaccine is social distancing, masks, and hand washing.
That's a great point. So let's say you and I are in the same room, right? And you have a 3-layer mask on, and I have a 3-layer mask on. Okay, and we're talking. We're in an enclosed room. I wash my hands, you wash your hands. Right at that moment in time, we are running at about 90 to 91% protection from each other. That's equivalent to a vaccine.
Yeah. On
that one-on-one encounter. So again, you have to think about the situation, where you're at, and those kind of things to understand it. It's not easy, but you have to think about it as layering, and that's the best way. It's Swiss cheese model.
I like that switch. I'm glad you taught that because I've never heard of it, and I think that it really puts it in perspective for someone who's a lay person who really doesn't know. I like it. It's good.
It's a common model that they use in business and healthcare and stuff like that, so people can kind of grasp the concept. It's an old concept, but it's a good one.
It still works. It's working for me right now.
Yeah.
It is.
Yeah. So the one thing that people have to understand with face masks, I want to make sure I cover that, is that the virus does stay in the air, and people have to recognize that, the ones who would like to rebel against wearing a mask when you're in public. And I tell my patients who are having issues with it is that I'll use a different virus. Let's talk about tuberculosis.
Oh, yes.
So if I have a tuberculosis patient, and they're coughing, it lingers in the air for 6 hours. That's why we have to use, when you're in the hospital, we use a isolation room with its own ventilation for tuberculosis patients, is because it stays in the air for 6 hours. Measles stays in the air for 2 hours. COVID does stay in the air. And so, when you're out in public, wear that face mask because you are actually protecting yourself. It is in the air, especially in enclosed environments, enclosed places. That's an important thing that you just need to know about, that layering up when you're out in public.
Layer up, not just against the cold, against the virus. I'm always sort of stunned by people that just don't think that it's a real thing. It just boggles my mind.
Well, it's a medicine battles culture all the time. And so if I have a patient whose culture demands that they eat rice 4 times a day and they end up being a diabetic, I'm going to have a battle controlling their blood sugars, right? I'm going to have a real tough time. Well, when the pandemic in Western Hemisphere, we value independence, we value personal rights. We value creativity, doing things a different creative way. But when you're dealing with a pandemic, it's all about infection control. You have to do it a certain way. You have to do it this way. You can't deviate. And that really butts up against our culture. And so we've had a tough time. That's why we're the most infected hemisphere in the world. It's because we have a tough time with those concepts under infection control. We just have to keep working at it, and we'll get there.
Do you find that this is like one of those questions that I guess I'm going to ask it? Are you seeing more cases in older people than younger people?
No, I think that controversy has definitely put to rest by this point in time. I think you see it in multiple age groups. The complication rate is a lot higher in the older you become, but no, you have it pretty well widespread at this point.
Yeah, so we don't need to be scared. So if we're living at home with yourself and maybe a few people and no one's really going out, then we can feel that we're pretty safe. But at the same time, you just never know.
You always don't know. And so if you're doing what you have to do, then you're doing what you have to do, and you have to feel secure in that. You're washing your hands, wearing your face mask when you go out, and you try to keep a social distance as much as possible. That's all you can do.
Do you believe that when this vaccine is administered, first of all, how fast are individuals going to be able to get this vaccine? And I read that if you're over 60 in that category, you're going to be one of the first to get it. Is that true?
Each state has their own protocols that they have been working out on distribution and who gets what and where and to get it. Right now, I think the big ones everyone's probably talking about is the Moderna one and the Biotin one.
And Pfizer.
Yeah, well, Pfizer is the Moderna one. Moderna is the company that actually developed it. Pfizer is the pharmaceutical that brought the rights. And then you have the AstraZeneca, which actually has rights to two. It has the Biotin and also the Oxford one. So the two that they're in the news most recently, one of them has a temperature requirement that is a challenge, but it's okay. It's the exact same challenge as the Ebola vaccine, which they'll work out, but it's about limited number. You're only going to have so many million doses that's going to be available, probably all the way up through February. And then the next vaccine will come. The Oxford one looks pretty good too. That's the one they haven't really talked about recently. And they'll talk more about it over the next few weeks. That's a 2-shot one too. It's not based off of the new DNA one. It's based off an adenovirus. But that one, it looks good. And then you still have the Johnson & Johnson one. That's still ongoing trial. They held it, but then they restarted it again. That one looks good. And that's coming out too. So we got some good vaccines coming out. And then, of course, you have the other one that's actually ongoing is the one that actually China's doing. They have a big study in Peru that they've sent out and several other countries that they sent out some preliminary data with theirs. It looks good. That's also an adenovirus. So we have some good things coming down the road.
It sounds like it.
It really does. I think if we can get through this accelerated growth pattern in the next 8 to 10 weeks, I would expect we would be seeing the light at the end of the tunnel by the end of the first quarter, beginning of the second quarter. That's
not so bad. I mean, I'm patient.
And that would be a year, right? And so when we started this thing, people were like, oh, they're going to go so fast, well, because the president was saying by October. Well, that was not true. By the time we get a vaccine, it'll be, start to come out pretty well. It'll be over a year since this thing started. Yes, it's faster. There's still some issues that are going to have to be learned as we roll this vaccine out. One of the main issues is if someone makes a mistake with the vaccine, how does that affect the immunity response to it? And those are things that we'll learn as we roll it out, but it should be fine.
Well, okay, so we went to the second phase with you. I'm going to ask you, can we follow up with you when the vaccine is rolled up? Would you be willing to come back on and talk to the audience?
Oh, yeah, sure.
Because this is great information. You give the best information, Dr. Clark.
Well, I appreciate that. Well, I will say the last thing is that if people want to know about side effects of the vaccine, I'll tell you what you really do is look up Shingrix, the shingles vaccine,
Okay.
because the side effect profile that I've seen in phase 1 and phase 2 and a little bit of the phase 3 that I've seen is almost exactly the same as the shingles vaccine. And that's a 2-shot vaccine. So, if you see those side effects, you can pretty much say, okay, I know what the side effects are going to be.
Well, I'm not as afraid as I was when we started this interview. Thank you. I feel better. I do, because knowing the information makes you feel like, okay, you don't feel helpless.
Mm-hmm.
I really appreciate you coming on, Bob. You're like the best, know?
I appreciate
and
you.
You seem you're relaxed and stuff, and you know your stuff. And I know my audience is going to really appreciate this interview for real. And hopefully by the time we interview again, things will start to die down somewhat.
We will be going. It'll be going for a little while, but it will be better. And I think people will feel better. And I'm glad the election's over, so people can focus in on things that are much more important.
It'll be a whole new phase. It'll be interesting to see what we feel like in our mood in the first quarter of 2021.
Yes, that will be good.
So I'm going to thank you so much on the eve of this Thanksgiving. And you're somebody to be thankful for, Dr. Bob Clark. You're the best. I got to tell you, I got to say, and I really appreciate you taking the time. And I can imagine you had a day and a half in a day. And to come on at this hour and talk to me, I really appreciate it. And I will say goodnight to the audience, and please be safe. Wear your mask, wash your hands, social distance. Do that. The vaccine is coming. You still got to do it anyway. And we're all protecting each other. And I like to think of myself as, a vaccine to the people that I care about by just doing all of those things and not spreading the virus. And so until next time, I'll say bye-bye. Thank you for listening to the Energy Stoners Cafe.
Thank you for listening to Passionate World Talk Radio. You can listen to this program all over again by going over to https://passionateworldtalkradio.com. You can also hear it on Spotify, Spreaker, Amazon Alexa, AMFM247.com every Tuesday evening between 8 and 9 p.m. YouTube, Facebook Live, LinkedIn, and all the other podcast directories one can find on the internet.